Hi, I'm Marc Gorelick, President and CEO at Children's Minnesota. I'm here today with Dr. David Gremmels, who is a pediatric cardiologist here with the Children's Heart Clinic. Dr. Gremmels serves as the Chief of Cardiology here at Children's Minnesota, as well as the Medical Director of our echocardiography program. So, David, thanks for taking some time to chat with me today.
Thank you. Happy and excited to talk about the cardiovascular program today.
Yeah, well, first I want to start congratulations. This year we recently celebrated 10 years since the establishment of the Edward J. Phillips Cardiovascular Care Center here. And I know when you and your colleagues got that started, it was a real kind of transformation in the way that we cared for pediatric cardiovascular patients, wasn't it?
Yeah, that was took a lot of effort from hospital and cardiovascular leadership to put together the space to take the fourth floor and remodel it into a state-of-the-art facility with 25 beds CVICU, the operating rooms right next to it, the cath lab, the pre-op area, our conference center, the sim lab, all of it right together on one space. Very few, if any, centers in the country have that type of facility.
Yeah, it's a beautiful facility. And you can talk a little bit about the fact that, the way you've set it up also really helps to support a very patient-centered approach to care, doesn't it?
Yep. So going along with that, it was a remarkable process of, which now is about 150 cardiovascular nurses who staff the unit. We changed the rounding model to be multidisciplinary rounds with intensivists, surgeons, cardiologists, charge nurses, and then most importantly, the family to be a part of it. So the facilities allow families to be there all the time, sleep in the rooms, and then when we round twice a day, the family is at the bedside to hear the plan, be a part of the plan, and understand how their child is doing.
That's great. So I know that you've had 10 years of success there, but in the most recent years, we've added a new component to that program, the heart failure and heart transplant program. Can you talk about that a little bit?
Yep, that's so I've been with the program almost 20 years, and that's always been probably one of the most disappointing things to be a patient's doctor. And up to just a few years ago, we did not have transplant at this institution, and we would have a patient in their sickest hour have to leave and be transferred somewhere else. And it was very disappointing for the families and disappointing for the team to feel like we let them down. Dr. MacGyver, Dr. Eric Edens joined us, and we put the transplant program together 2 years ago. We've now done 5 transplants. We've had 9 patients on ventricular assist devices, and so we've been able to maintain all patients throughout their care here at Children's.
That's great, because I know that over 2/3 of all the kids in Minnesota who need a heart transplant, they start their care here at Children's Minnesota. And so they had to be transferred to a new care team, sometimes out of state. Now they can get all the care they need right here closer to home, which is fantastic.
Yep, that's, again, was a missing piece of the puzzle for our CV program. Always difficult to try and put all those resources together. So the leadership team, administration, nursing, again, everything to get a transplant program started here was a big endeavor, and it's gone off tremendously well the last 2 years. This year we'll have the CMS, so the Medicare, Medicaid Services team visiting shortly. Getting their approval will be another kind of milestone for the transplant program.
Yeah, that's fantastic. So I understand you have some exciting new things to tell us about what we have to look forward to even on top of all that past success.
Yeah. So the next phase, again, we've had multiple conversations, and earlier this year the surgical team put together a collaborative agreement with Mayo Clinic. Now Children's of Minnesota and the Mayo Clinic team is expanding that to the entire pediatric cardiology services. Oh. So that was finally signed this week. As we have this agreement, it's going to lean on the strengths of both programs. Again, we're taking a very large metro children's hospital that has had tremendous success partnering with a great academic institution to be what will be, one of the largest cardiovascular programs in the country.
That is really exciting. Tell us a little bit more about how that collaborative is actually going to work.
So the key, I think, for both programs, which is why it's aligned and works so well, is the focus on patient care and great outcomes. So both of us have very similar philosophies, same focus, same goal. Again, both campuses are going to try and lean on each other for their strengths. As the program gets bigger, we can use examples like outreach, our outreach expansion to to bigger areas of the Dakotas, of Wisconsin, of Iowa. So to grow with Mayo, to see more patients, to give access to all subspecialty care services. And then another example would be like the fetal team. So how we're going to take the fetal team or the heart transplant team and grow together when you're talking about smaller volumes and provide outstanding care. That's the goal together.
Well, it's great news for the kids in this region who need care for cardiovascular problems. David, I thank you for all your leadership over the years and for everything you and your colleagues have done to really progress the ability to take care of those kids with very complex needs. Thank you so much.
Thank you. It's my pleasure to be a part of the team.